You talked a little bit about, brown or red urine. Could you share any additional symptoms that, people may experience if, they're at risk for RMC?
Yeah. Thank you for asking that. So, if you actually do have RMC, the blood in the urine is one of the big ones. Another thing that can happen is, you may start having unexplained fevers. Very often fever is not RMC, okay? So when you develop fever, you shouldn't say, oh my God, I have RMC. But if you're having fevers and you're starting to lose weight, and it's unexplained, it's not intentional, you did not intend to lose weight, but you're losing it, and you're losing weight, you're having fevers, and you may have pain. And if you have pain in your flanks where your kidneys are supposed to be, especially on the right side, since it's more common on the right, but it can happen on the left as well. Those are some of the symptoms that should alert you that something is off. Now, again, very often, this will end up not being RMC, but, investigate it and do the imaging. And sometimes that's another thing to keep in mind. You don't want, obviously, to overdo it and be, scared and say, oh my God, I have RMC, every few months, and do, let's say, CT scans, CAT scans, because those CT scans have radiation. They expose you to radiation. So we gotta have a fine balance. But if you're having blood in your urine, you're not supposed to have blood in your urine. Have somebody evaluate it. If you're losing weight and you didn't intend to do that, and you're having pain in your flanks and blood, take it seriously. And if they do the imaging and they find a mass and they tell you, oh, don't worry about it, it might be benign or whatever, no. It may not be benign, especially if you have the sickle cell trait. A mass in the kidney, especially in the right kidney, in somebody who is young, should be taken very seriously.
Got it. That's really good information. What if you just have one of those symptoms, like maybe just the pain in your flank, or is that something to ask your doctor about, or is that?
You should always feel free to ask your doctor about anything that concerns you. If it's something that concerns you, then you need to talk about it with your doctor. Now, the more you combine the symptoms, the more likely you are to have something. So if you have only one thing and you have another justification for it, so let's say, you strained yourself and now you're having pain, then that's by far the most likely answer. But, that's what clinicians are here for, to help answer those questions and help out. So feel free to ask your doctors when you have something that concerns you.
Got it. And then I guess just to follow up with this, I mentioned I live with sickle cell disease. I guess when writing these questions, that we had to ask you, I didn't know that, I didn't consider myself as at risk as, sickle cell trait. So now I guess I'm asking for myself and for my daughter, what should I be mindful of, or what should we be mindful of at doctor's appointments? What should we be tracking? Are there anything, any, I guess, lab indicators or anything to talk to your doctor about on a more routine basis?
Great question. And that applies both to the disease and trait. Not yet. So, and we have to be very careful with this. And that's why I'm saying not yet, because if we overdo it with the screening, if we're being too intent on finding something, we may end up causing more harm than good. And what do I mean? First of all, I mentioned, if let's say we start doing screenings by doing CT scans, we expose somebody to radiation, and that in itself can cause cancer. But also, another thing to always keep in mind when we think about these screening tests is that there's always a chance when you image yourself that you're going to find something that's unusual. We all are unique. Our bodies are unique. So if you do a CT scan on me, there's no doubt you're going to find something that's odd. And if you do it on you and anybody, you're going to find something that's odd. And so that can be harmful, because if you think, oh my God, I have RMC, and then, you do a CT scan and find a small thing that is nothing most likely, but then you're scared, you may end up, doing a biopsy, which is an intervention, and then cause more harm than good, because, biopsies can have complications and you may have bleeding, all of these things. That's why we're so very careful with our recommendations, because we don't want to harm the community. And so right now, we don't have any lab tests, screening tests that can tell us, oh, you are like, you may be at risk for RMC. But that's what we're working towards. That's why it was exactly because the patient advocates, the advocates community in 2017 said, please, what can we do to understand why RMC happened in some people and doesn't happen in others? And for example, that story about the high intensity exercise is a first step towards that. So now we know, for example, and that applies to you, if you are doing very high intensity exercise, you got to be a little bit more mindful about the possibility of it happen. Or you can adjust your exercise regimen, as it is now recommended for people with the trait and the disease, to prevent such complications.
Got it. Just as a disclaimer, I'm definitely that patient where if I have like 2 of those symptoms, I'm freaking out and I'm going to get the biopsy and the CAT scan and everything else. So thanks for thanks for level setting us for that. I guess my next question is, overall, when you think about sickle cell, what are some additional things that individuals can do to decrease the risk of, kidney complications? And I know you spoke a little bit about exercise. I'm not really sure where sickle cell disease fits into that, in that conversation, just because, we're told, I think, just growing up, I was even told not to exercise. And now research shows, oh, well, exercise could be important, but, everything in moderation. I'm not sure where we fit into that, but besides exercise, are there any other things that we can do to make sure we are, to keep that risk level lower? Any foods, any, dietary considerations, anything like that?
Great question. And I think you hit the nail on the head when you said, that everything in moderation. I find it hard to believe that exercise in moderation would be bad for any group of people, including individuals with sickle cell disease. You just have to do it, in a structured, specific way. And I think that, exercise can help people with sickle cell disease, and certainly people with the trait. There is no doubt. And I would say, we're still learning more about the effects of diet and the effects of, certain drinks and hydration. But I would say that, for example, this, having the disease, hydration is important. And more importantly, if you dehydrate yourself, you are more likely to have the sickle cell crisis. And in that same way, the same thing in a way can apply conceptually. We haven't yet proven it, but can apply if you have the trait. So if you have the trait, remember what we said, that the medulla looks the same when it comes to the sickling or red blood cells, whether you have the trait or the disease. So if you dehydrate yourself a lot and you strain yourself with exercising, then you may damage your kidneys more. So stay well hydrated. Those recommendations about good hydration before starting the exercise, drink 17 to 20 ounces of fluid, a couple of hours before starting the exercise, to allow, your body time to reach normal hydration levels. That's important. And then, there are beverages that, contain electrolytes that can be helpful, carbohydrates, maintaining this fluid electrolyte balance. That I think is important. Now, we're still trying to understand how certain diets can help. I don't think that we've gotten there yet. So, the problem is that if I recommend a specific diet, that may end up being harmful and cause more harm than good. I would say, again, balance, moderation. What you said about moderation is important. Keeping your body weight, at a good level. is also important, whether you have the trait or the disease. You don't want to be, overweight. That can cause all sorts of problems. And at the same time, you want to eat, have a good, healthy diet. I think that those are some recommendations overall for the community.